All right, we continue to help you look and feel your best with our Improve You segments. Today, Botox and big lips continue to be big with many women wanting to look their best. But you don't want just anyone doing this type of work on you. Dr. Waldrop at the MedSpa at IQ has years of experience volumizing lips. We were just talking about that during the break. Dr. Waldrop, thank you so much for being here. Appreciate it.
Thank you for having me.
All right, first of all, I've got to get to the special right away because this is really exciting. It's kind of like getting your lips, how do you call it, volumized?
Yeah, filled a little bit.
Filled for free? Is that kind of what you're doing? Let's talk about that.
No, we have some Botox, and if you get the filler, the Juvederm, you get some free Botox with that.
Perfect.
So that's the special.
Gotcha.
Yeah, but a lot of times when people come in and they're saying, you know, Dr. Waldrop, my lips are kind of just disappearing. And that's really, the lips are such a nice area to fill because it really gives you back the volume that you used to have. It's really not about making your lips bigger. It's about really kind of restoring something that maybe you had 10 years ago or 15 years ago.
So they start to...
They just lose volume.
Volume
over time they lose volume. And full lips are a very nice, youthful look. But on the other side of that, lips that have lost volume really kind of add age. So I often tell patients, like, if I had one syringe of filler to use, most people I would use it on their lips.
Really?
Yeah. And a lot of times people are very concerned. They've seen all those negative things.
Yes, yes. Where they kind of look like balloon lips.
Yeah, and that's where it really comes back to the experience and really understanding that different anatomy, people with fuller lips you approach differently than people with smaller lips, and so all of that stuff kind of goes together. I actually brought some filler here so that you can kind of see and feel what it looks like.
Okay.
Let me just get the top off.
So where do you fill it in? Do you fill in the actual sides of the lips, the actual lips themselves, or how do you do it?
So again, that's part of the conversation that you and I would have when you sit down, and there are different approaches on some of it, and some people have very specific requests, and then some people come and say, well, you're the expert, what do you recommend? So, and I often have, you know, I have that opinion, but I want to hear what they say. So somewhere in there is the answer.
So that's it right there, huh?
So this is it right here, and you know, you can just see what it...
Oh, is this the filler? Oh, wow.
So you can just see what it feels like a little bit. There are not many people who know what it feels like because
it feels so soft.
Yeah. And it's a product, it's a sugar gel. It's something that's naturally in your body, and that's what you're losing over time.
Okay. Does it stay, how long does it stay for?
It's about a year.
That's pretty good.
Yeah, it's really good. And it gives you a lot of flexibility. It's a very safe product.
Look at these before and after pictures. This is a perfect example of how good lips can look after being filled like that.
Yeah. And I think that lips, you know, I take a lot of pride in how I do them, and I think it takes a lot of years of studying and training. So I've really enjoyed it. It's one of the things that I think really makes patients feel good.
Definitely. So what about the vertical line lips? And sometimes we get lines and wrinkles around our lips.
Yeah, so there are different ones. There's one here called the nasal labial fold, and then they have one down here called the marionette lines, kind of like a puppet. Those are, you can use the same fillers for those things. Yeah, and again, they last about that same amount of time. They're very safe products, and the discussion that you and I would have regarding what areas we can do and how much you'd get out of it, I think that's the important part of doing some of this stuff. But it's safe, it's effective, it makes people feel good. Yeah. I love them.
And it's really all about making yourself feel good, you know?
Is.
What about Volbella? I know that's also a filler, and it's also for wrinkles, right?
Yeah.
Okay, so you offer that as well.
Yes, that's the newest one that they have. And it's actually, interesting off this, it's a little bit thinner version of the same product. So it's better suited to go into some of the really fine lines, you know, the little vertical lines that people get around their lips. That's one, and that's something also, getting back to the Botox, that the Botox can help address some of those little fine vertical lines. But I have women regularly say, you know, my lipstick runs up there, or I just hate those little lines. I'm not a smoker, I never was. And it's just the musculature there that they can get it. So those two things can help address that.
What about Botox?
So Botox is great.
Everywhere, right?
Botox can be used everywhere. The areas it most commonly is used is kind of between the eyes, around the eyes. But I will use some around the lips, and that's part of the special. And we'll use some down here also, kind of things that can really help rejuvenate. They look natural, they're soft, they give a lot of nice little changes.
All right, tell us about the special again.
Okay, so with the Juvederm,
With
the purchase of a Juvederm, you get a free Botox treatment for around the mouth.
That's such a great deal.
Yeah.
What a really a great deal. So remember to call Dr. Waldrop at 317-6777, 317-6777. If you purchased some Juvederm or Volbella, is that right?
Yeah.
Okay, then you get a free Botox lip treatment, and you can look good and feel good all summer long. Dr. Waldrop, thank you for making us feel good and improving our self-esteem and our looks. I love that.
Well, thank you.
All right, thanks for being part of our Improve You segments. Stay with us. More after this break.